Do I need to do an annual checkup on my Medicare coverage? Do I need to review my Medicare coverage annually is the better way to say it. That's a question we get a lot, okay? And a lot of people don't do this. So 71% of people, based on a Kaiser Family Foundation poll recently, were not reviewing their coverage annually. And so I'm going to break down whether or not you need to do that. And I would appreciate it if you would give us a thumbs up or subscribe to the YouTube channel. Thank you so much for watching. Now, before we get right into that, I hope that you'll head over to BobbyBrockInsurance.com/book. That's BOBBYBROCK insurance.com/book. Get your free copy of this book that I wrote called Medicare Breakdown, the Alphabet Soup of Medicare. Tons of good information in there, specifically an entire chapter actually on what we're about to go over. Okay, do I need to review my Medicare coverage annually? Well, your Medicare coverage does change depending on what you have, especially your Part A, B, C, and D, the parts of Medicare. Parts A and B can have cost parameters change, like the deductible can go up, the daily copays can go up, and if you have a Medicare supplement coming in to fill the gap in those plans, the Medicare supplement probably isn't changing because it is guaranteed to fill the same gaps as it was before. However, there can be some holes in those supplements. For instance, the Plan G, which is the most commonly purchased Medigap plan now, comes in and fills up all the holes in Parts A and B, except for the Part B deductible. And that Part B deductible can go up each year. Those are relatively small changes if you're in that boat where you have a Plan G or Plan F or a Plan N. However, you probably have a Part D plan, and that's where your annual reviews really come in. The fall annual enrollment period is actually only for Part C and D, your drug coverage or Medicare Advantage. That's what it's for changing. A lot of people do shop their Medicare supplement plans that time, but you can shop your Medicare supplement plan any time of year. There's no requirement of when you do it, and in most states you just have to answer health questions and pass medical underwriting to get approved for a new, better cost or better coverage Medicare supplement plan. Now, on the Part C and Part D, do I need to change it every year? Really depends. You're going to get an annual notice of coverage letter called an ANOC, which is going to talk about your new benefits for the coming year. And if your prescriptions haven't changed a lot, your doctors haven't changed a lot, you review that annual notice of change and there's not a lot going on there, it's about the same, you don't necessarily have to do anything. But if you're really confused about whether it's the best thing for you, you've had a lot of changes, you're moving, your annual notice of change says that the benefits are changing like crazy or the plan's going away, of course you do have to make an election to change. Now there are a multitude of factors, primarily massive amounts of call centers calling people trying to convince them that they need to change now. Every year it's been happening more and more each year, but they don't necessarily need to do anything. There's not a bunch of new benefits that didn't exist before. It's just Medicare Advantage is expanding into certain areas, and everyone is calling these areas to try to get people to change their plan. If you wonder if you do need to change, I really would advise you to check out this book at BobbyBrockInsurance.com/book. You can get a free copy. You can order it on there. We'll send you one, or you can give us a call at 662-844-3300 to claim this book. You can buy it on Amazon too, and then that puts you out of having to contact us at all to get your copy. But we would love for you to buy it because it kind of clears up a lot of that. It's a whole chapter on whether or not you need to review it. There's some big problems with not reviewing it if you're not paying attention to what that annual notice of change says. However, it's hard for us to tell someone that they have to review it every year because 90% of the time it seems like there's not anything crazy they need to do. But there have been some big Part D changes in the past, so it's something to look out for. You really need an agent, or you really need to be super educated. And this book is a lot simpler than the Medicare and You Handbook. It's very condensed in a format that's easy to read and easy to follow, and maybe even a little bit of fun. So check it out, and thank you so much. Please subscribe to the channel and give us a thumbs up below if this was helpful.